can you get your teeth broken with Ozempic, Wegovy, or Mounjaro? Well, it's a yes. I'm Dr. Rajeshwaran, consultant endocrinologist and bariatric physician. So I'm going to discuss about why people can break the teeth or get it chipped, especially if you're on Ozempic, Wegovy, or Mounjaro. As you know, Ozempic is a medication for diabetes and has been used for weight loss as well, but it's licensed for diabetes only. Wegovy and Mounjaro is licensed for weight loss. So why do people get problems with the teeth? I want to explain to you in detail the 4 important reasons why someone can have a broken teeth or a chipped tooth. Okay, so before we go into this, let's start looking into what are the side effects of this medication, glucagon-like peptides, which is Ozempic, Wegovy, and Mounjaro. The common side effects are nausea, vomiting, heartburn, constipation, diarrhea. So these are the common gastrointestinal side effects, and they can also sometimes cause drying of saliva, so you can have a dry mouth. So keeping that in mind, let's go through the 4 main reasons why someone can have problems with their teeth. So the first is dry mouth. So glucagon-like peptides, that's Ozempic, Wegovy, and Mounjaro, can reduce your saliva production. And as you know, saliva in your mouth provides a natural defense mechanism. It neutralizes the acid and also washes away harmful bacteria. That's to put it in simple terms. So you need your saliva. It's not just for digesting, but also to make sure your oral hygiene is good. So when people are on these medications, you have dry mouth, and that can trigger problems with their teeth and gums. The second reason is nausea and reflux and vomiting. So when someone vomits, you obviously gush out acid, specifically hydrochloric acid, which can erode your enamel, the protective enamel which you've got around your teeth. So that can be eroded, and which again causes problems with teeth. The third thing is people who are on Wegovy and Mounjaro lose weight. Their appetite is suppressed, so they tend to eat less. Inadvertently, they may become nutritionally deficient, specifically to calcium and vitamin D, which are important to maintain your bone health and the dental health. So you lose out. And the last reason is because your appetite is suppressed, people don't eat at the right time. They may skip a meal, and they may sometimes just have fruit juice, and they may not have a proper balanced meal. So that changes the natural pH balance of your mouth and resulting in decay. So though this complication is rare, but it is reported widely. So I would advise you to be careful, especially if you're on these medications. So the good news is that this can be prevented. So the most important point is I always tell my patients, please drink 3 liters of water at least. And if you're exercising hard and you're sweated a lot, even make it to 4 liters a day. This is provided there's no contraindications, like problems with your liver, kidney, or heart. You should consume at least 3 liters of water. So it keeps you well hydrated, and make sure that even if you have a dry mouth, your mouth is not allowed to dry too much. So make sure you drink plenty of fluids. And as the dentist advised, use a fluoride toothpaste and a good mouthwash, which will strengthen your enamel, especially when your saliva is low. And the third point to avoid this is make sure you have a balanced meal. Always consult your dietitian, talk to your doctor, get calcium and vitamin D supplements if you're on Ozempic, Wegovy, or Mounjaro. Now, as you know, I said that after vomiting, there's a lot of hydrochloric acid in your mouth. So it's always important to rinse your mouth. And before going to bed, brush your teeth. But despite all this, if you find that you've got sensitive tooth, or you're finding that there's some problem, you've got dry mouth, you should immediately seek an appointment with your dentist to get your teeth checked out. So this is mainly to make sure that you don't have a chipped or cracked tooth. Sometimes I advise my patients who have got really dry mouth to stimulate saliva production and use a sugar-free chewing gum, which sometimes helps. But obviously, you need to make sure not everybody likes chewing gum, but try and see if that helps. So the bottom line is, yes, chipped tooth or broken tooth is possible if you're on Wegovy or Mounjaro or even Ozempic, but this can be prevented if you follow the advice I've given. Hope this was useful. Bye for now.